Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health.
In this week's program, we'd like to continue our discussion with Dr. Bill Kleber of Berthoud, Colorado, and primary care and how it relates to chiropractic. So let's continue.
I'd like to ask you, and you may have already answered this to some extent, but why would a person pick a chiropractic physician over a medical physician in the primary care setting?
Well, I think that's a great question. I think the advantage is that they're not in most ways constricted by the insurance company, and they have a different philosophy. They have a different outlook. They believe that you're supposed to be healthy and that the body has the ability to maintain and heal itself naturally. Mm-hmm. And if you could teach people how to stay healthy and what good health habits are, how to eat, which supplements are best for them from an analysis of their history, their blood work. If you can teach them that, they'll stay healthy. But the medical physicians generally only have drugs to offer. They wait until your symptoms or signs are bad enough, and then they put you onto medication, and basically they mask the problem. They don't fix the problem. They really don't teach you how to stay healthy. I mean, to me, their idea of preventative medicine is a mammogram and a pap smear. You know, and I don't really love ionizing radiation. And by the time you pick up cancer on a mammogram, it's very late. It's not early. Mm-hmm. We like to prevent disease rather than wait for it to occur and then mask it. So I think we have people love the idea. They're happy. And, you know, for any of the chiropractic physicians out there who are listening, I'm telling you that this is the future of chiropractic and that there are patients out there who are literally and figuratively dying for your services. You know, I'll leave it at this, Keith. At one of these FCA conventions, I talked about the difference and what the desired clinical outcome is. In one instance, you might say, well, I went to my medical doctor, the staff was friendly, they took me on time, and they forgave my copayment, and the doctor wanted to get my cholesterol below 200, and that was the desired clinical outcome, and the desired clinical outcome was achieved. On the other hand, I say, getting your cholesterol below 200 doesn't assure you of anything as far as health, longevity, decreased risk of heart disease. That can be measured. The desired clinical outcome for me and my wife is when we're in our 80s and we're sitting on a dock drinking pina coladas, watching our children and grandchildren and maybe great-grandchildren water ski. That's and feeling good and being healthy. You can't measure the desired clinical outcome with a simple number. It's a lifestyle, and the desired clinical outcome will be determined later on in your life by whether or not you're on multi medications or you have abundant health. And I think that's the difference between choosing a primary care doctor that's a chiropractor or one that's a medical doctor.
Okay. Bill, can you kind of talk to us a little bit about maybe specific disease that you've had experience with that really plays well into this idea of what I'm going to call alternative or natural primary care?
Sure. I would say that the primary thing that I see in my clinic is, and you know this, Dr. Keith, it's fatigue.
Right.
People go through life not even understanding what the potential for their energy level is and how they feel. I kid around, and I'll choose my words more carefully since this is going to be on the radio. But you can imagine what the words really are. People come in and they say to me, Dr. Kleber, I used to just feel like crap. But that was okay, I didn't have, and people don't have very high expectations. And the young people today, I don't think that most of them have any idea what it feels like to actually wake up and feel great. But they'd come in and they'd say, Dr. Kleber, I used to feel like crap. But now, I don't know, I felt like crap for a long time, but now I feel even worse than crap. Dr. Kleber, can you please help me feel like crap again? I go, no, I won't do that. If you want to, because things don't stay the same, like we say, and you have to get better and better, and people have to understand that they're here to feel an abundance of energy and to live every day feeling great. Even when you're older, I don't lower my standards. People, the number one complaint is fatigue. That's the number one complaint. So it could be that they have a B12 deficiency. It could be they're not absorbing it. It could be that they're hypothyroid. It could be that they don't make energy on the cellular level. And energy is not something that you will. Energy is a chemical. It's called ATP, adenosine triphosphate. We make it in the Krebs cycle. And you have to be able to burn either glucose or fat to produce energy. So we help people learn how to switch from a poor glucose metabolism to an efficient fat-based metabolism. We have to identify the cause of the fatigue. A lot of people have chronic reoccurring Epstein-Barr virus infection. They have a lot of infections in the body. Keith, if you say to me, Bill, what do you do for a living? I'd say I find chronic low-grade infections in people and I fix it. That chronic reoccurring Epstein-Barr virus infection, as you know, Keith, is called a chronic fatigue syndrome.
Yes, yes. And it's
fibromyalgia, all of these chronic diseases that people have that really need to be addressed in a more holistic way. The quality of their lives and the lives that they touch every day are all improved.
And I think it's interesting to note, Bill, that a lot of times people don't even know that they've got these chronic issues ongoing. They just know that they feel bad. And when you talk to them about infections, et cetera, they look at you like you're nuts.
Yeah, we hear it all the time.
It's unfortunate that they feel bad, but then they say to their friends, well, how do you feel? Right. And their friends feel even worse. So the bar gets lower and lower because they think that how they feel is normal. And I'm here to say it's not normal.
Right.
You're supposed to wake up, eat 3 meals a day, be a little bit tired but not fatigued at the end of a busy day, and be able to sleep well. Half of these people are tired because they can't sleep. They have trouble falling asleep, staying asleep. They're restless. Look at all of the advertisements out there for sleep medications. And there's reasons that they can't sleep. We sometimes test DNA and look at how they're producing neurotransmitters and whether or not they have excessive excitatory neurotransmitters, or they just don't have enough calming neurotransmitters. There's imbalances. Everything is about balance, and I always say God didn't put anything in your body that was bad. It's just that things don't, sometimes they get shifted. High stomach acid's not bad, cholesterol's not bad, things like homocysteine aren't bad. It's when they're not being converted into the things that they're supposed to be. So that's the number one issue out there, in my opinion, is fatigue. And there's multiple causes of it, and it has to be identified. I always ask patients on a scale of 1 to 10, with 10 being good, where's your energy level? Sometimes people will say to me, well, 7. And then I start treating them. And a month later, they come in and they say, I'm feeling a lot better. I just feel so much better. And I'll say, well, what's your energy level now? And they go, 7. I said, no, you said you were a 7 when you came in. They go, oh, I wasn't a 7. I thought I was a 7. I was a 4. And Keith, you know that they do that all the time. They don't know what they're aiming for.
Right.
And
Bill, I don't
one of-
know about Colorado, but we live in South Florida here, so we have a lot of folks who retire here who are part-time residents. But we have a lot of folks who people love to market to, and when you turn on the television in the morning, just about all you see, every other commercial is for a medicine. It's for some type of drug they want you to ask your doctor if you can take because you might feel this way or that way. And it's pushed very, very, very hard here. I don't know about Colorado, but it's just in your
I
face
think
all the
it's
time
everywhere.
here.
Yeah, and they say ask your doctor. I don't think they really say that. I think they're saying tell your doctor that you want this.
Right, because they
because
tell you what your
saw it on
symptoms are.
television. And if you don't get it from them, you'll go somewhere else and get it.
Right.
You'll get it. And it's just an unfortunate and sad, desperate attempt by the pharmaceutical companies to make more and more money. And it's true. And the patients deep down know that, but they don't know that they have other choices. They don't know that they have other choices.
And I think that's
They're
where
on so many medications. I mean, Dr. Keith, you know that a lot of your patients could come in, they're on 6, 8, 10, 12 medications, all of them with side effects.
Right.
And they're taking medicines to counter the side effects of the medications that they're taking. This could be remedied. And
Dr.
their quality
Bill,
of life could be so much more improved.
you're right.
We've just been misinformed. That's all I think.
I wanted to interject here. I don't know about you, but we see a lot of patients who come in and we ask them what medications they're on in their initial paperwork. And, now they're producing a typewritten list. They just pull it right out of their purse or out of their wallet and provide that to us. There are so many things that people are taking.
Oh, absolutely. Absolutely. They can't remember them all.
No, how could you?
They have to write them down.
Right.
And for some of them, and they wonder why it is that they are so tired and don't feel well.
And the medication that'll make you feel the worst as far as fatigue, they're often on beta blockers.
Mm-hmm.
They're on beta blockers, and if they're on beta blockers, well, then they can't. If they're men, they can't get an erection, so then they take Viagra. I had a patient once, this older gentleman. He couldn't sleep, so they prescribed a sleeping pill, and then they prescribed Viagra so he wouldn't roll out of bed.
We may have to edit that one out of the show here. No,
You may not. I know you could edit it, so give it a shot. People will like it.
Yes, I understand. As we've been discussing this, Bill, one of the things that we've mentioned, quite often is the effect that insurance has had on the paradigm of healthcare in today's society. What's your opinion about, paying cash? Do you have a problem with people paying cash instead of using insurance?
Quite contrary, I prefer it. There's reasons that I don't accept any insurance, and it's not to make it difficult for the patient. The reason that I don't accept insurance is that insurance is what's killed our healthcare industry. The cost of our healthcare is skyrocketed. When you have insurance, the doctor, unfortunately, can only spend a certain amount of time with you. And most doctors today work for larger companies and hospitals and healthcare systems, from Kaiser to a healthcare system in a state, and they have to abide by guidelines. They can order tests only under certain circumstances because they don't want to be, or they cannot cost the insurance company more money. Most people don't have, that I see come in, they don't have sufficient testing to come to an accurate diagnosis. For example, when looking at thyroid function, a lot of people come in with a lab that only has TSH. And I say to them, you realize that this is not a thyroid hormone. And they say, no, that's what my doctor checks to check my thyroid. I say, well, it's a pituitary hormone. We need to check the free fraction of T3, the free fraction of T4. We actually need to check your thyroid hormone, and we need to know whether it's an autoimmune form of hypothyroidism, because it's all treated differently. But the medical profession has one-size-fits-all. If your TSH is high, you take more thyroid hormone. If your TSH goes low, you cut it back. And it doesn't work very well, as anybody who has a thyroid problem out there will know. I don't have the insurance companies dictate to me how much time I can spend. We charge a reasonable amount of money for what we consider to be an outstanding service. I could spend as much time as I like, and it's probably a lot less money than you think. I tell students in my classes, I say, well, if you're afraid to charge a fair fee, think about this. When was the last time you had a root canal done? How many thousands of dollars is it for a root canal? For a couple of $1,000s, I could probably take somebody whose life has been really devastated by an illness and turn it around. It's not tens of thousands or anything like that. But people are more than willing to pay for your time and your focus and your expertise and the best job that you can do. They say, I just want you to listen to me. I will pay you what you want, but I want you to hear me out. Nobody's listening to me. Nobody seems to have the time. And I make sure that I have more than enough time for each new patient. Or so I'm backed up in new patients. It takes a while to get an appointment. But I make sure that I have the time and that I do the right job. I really try my hardest to do the right job. And you know what? People really appreciate that. People walk out to the front desk and they say, I've never had anybody spend that much time with me and do that thorough of a consultation or an examination. And sometimes those people will refer other patients before they even get the results of their tests or whether or not they've gotten better from our care, simply because they were so impressed with the fact that we spent the time that was necessary. And you can't do that. And patients are happy. I pull people, in these classes, I say to the doctors, I go, are you happily married? They go, well, first I go, are you married? They go, yes. Are you happily married? They go, yes, especially if their spouse is with them. And I say, how much would you pay if your wife was chronically ill? How much would you pay? Would you pay $500? Yes. $1,000? Yes. $2,000? Yes. What's the upper limit of what you would pay to help her get really well? And they usually say whatever it takes. And that's how most people feel. And the insurance doesn't pay for much anymore. Most people know that. They go, they get co-pays, they have deductibles, and it's not paying for much in the office anymore. I wish everybody didn't take insurance and that we were all on a level playing field. I'll tell you, it would lower costs and it would improve quality of care. I think insurance should be for catastrophic illness only.
Okay, Dr. Kleber, thanks for your comments about health insurance. I guess the bottom line is, why would people pick a chiropractor doing primary care, and how would that specifically fit into the healthcare system of today?
Well, I think you pick a chiropractor because they have a true vision of the fact that the body can maintain and heal itself naturally. They have the opportunity to sit down and take the time that's absolutely necessary to make sure that your health coverage or that your health care is done properly. Anything else, it's an investment. It's an investment in time, effort, and money. But health is a commodity.
Right.
And it's a commodity in my book that, really is hard to put a specific price tag on. Either you're healthy and you're going to live a healthy life, be happy, or, you could try to do things in a more quick, slipshod, cheaper, and I don't even think it's cheaper, by the way.
Right.
But, it appears cheaper if your insurance is paying for it. But in the long run, it's way more expensive to get sick and then try and get well rather than to maintain your health.
Bill, you've hit the nail right on the head. And that's what we at Volstead Chiropractic and Integrated Wellness are all about. Especially with the primary care aspect, our goal is to keep our patients healthy. Now, certainly they're going to come in with chronic illnesses, et cetera, but once they're healthy, the goal is to keep them healthy as well as to reduce their risk of developing chronic disease or even acute disease sometime in the future. Being human beings, we're certainly going to have the risk of developing some types of diseases, but if we can reduce your risk as a patient, then I think we certainly have done our job.
Okay. One other question, if I may ask here. As you know, I've completed the DABC program. That's the Diplomate of American Board of Chiropractic Internists, as you have. And as a matter of fact, that's how you and I met, as you are the teacher of this program. What advantage do you see for a chiropractor like myself in having this diplomate status as an internist with the healthcare here in Jupiter, Florida?
Well, it sets you apart. It sets you apart, and it says that you've taken the time and you've put in the effort and you've passed the examinations so that you could also provide primary care, and that your experience and education is superior to other doctors in your area.
Right.
And Keith, it's a wonderful blessing. I mean, the reason that I go around the country teaching this kind of course is so that patients have choices and they have some sort of accessibility and some choices in the type of health care that they have. And I hope that those choices never get taken away. And I hope that people realize the blessing they have in having you available for them to seek out this kind of help. I think that, chronic conditions respond beautifully, and those patients with chronic conditions turn into lifelong patients. And that's the goal of what we do.
Right.
Yeah, Bill, it's such a nice thing to be able to help a patient and see them get better without having to go to the next level with drugs. It's such a joy.
It's just it's a reward, and I've always told my kids, figure out what gifts God gave you, use it for His glory. He'll take care of the rest. And Keith, I know you have these gifts, and I know you have the education. And I think that if anybody is looking for a different and superior form of primary care, that they consider going to see you, quite honestly.
Well, I appreciate that, Bill. I know you're running on a tight schedule here, and I do appreciate you taking time out of your busy day to be with us today. We maybe can look forward to talking with you sometime here in the near future.
I would look forward to it. Good luck to you and your wife, and your patients and your practice. Go out there and do a great job, and enjoy all of your education and the blessing that you have in providing this health care to these people.
Thank you, Bill.
Thank you so much for being with us today, Dr. Bill. We really appreciate it.
No, it's my pleasure. Thank you.
Wow, Laura, what a great call. I've really enjoyed talking to Dr. Bill. I've had a lot of experience with him in my 3-year residency program in internal medicine as a chiropractic internist, but it was really great having him come on our show to explain to us how chiropractic and primary care are very synonymous and, go hand in hand.
Yes, it's like the old saying, everything old is new again, because didn't chiropractors used to be the primary care physicians years ago? Like people would go to chiropractors instead of their medical doctors because they wanted something a little different, wanted to start there and then ramp up from there if they needed to.
Well, in the history of chiropractors, you're absolutely correct, Laura, were primary care physicians. And when they first came on the scene, they would be the primary care physician for many, many people because people wanted an alternative to the medical physician. It was only until recently, I guess last 30 years or so, when the insurance boom hit, that chiropractors kind of lost that primary care status and kind of pigeonholed themselves into just neuromuscular conditions. So the primary care thing is coming back, and chiropractors are leading the forefront of that, especially under the healthcare systems of today.
Right.
General practitioners are going by the wayside. All the medical physicians want to be specialists. So that normal old-time GP that used to be in everybody's neighborhood is kind of a lost art today, but chiropractors are able to fill that void.
Right. So it's now becoming, again, the place to start and to go to stay well. And if there is an issue, of course, you've done that many times. Someone's come in and you see that they need to be bumped up to additional care with a medical doctor. We just send them right back out the door.
And that's an easy thing to do here in Jupiter because they're all
Right.
over the place with Jupiter
Right.
Medical Center,
Right,
a
thank
wonderful
goodness.
facility, right?
Yeah.
But not everybody needs to be ramped up to that type of
Right,
care. Their
right.
bodies can take care of themselves if just given the opportunity.
Oh, and the other nice thing, Doc,
What's that?
is that instead of waiting 4 or 5 weeks to get in to see somebody,
Right.
we can usually get them in, if not same day, within a day or two.
That's right.
To be seen so they can get right on the road.
That's exactly right. That's absolutely correct.
Well, that about wraps it up for another edition of the Chiropractic Corner. Dr. Volstad and I would like to thank you for listening, and don't forget to let us know what questions you may have for Doc or topics you'd like to learn more about by emailing us at M as in Mary, CHIRO, the number 1, at gmail.com. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd love to hear from you. Google Volstad Chiropractic to find our website for more information about our office or to listen to archived programs from the Chiropractic Corner. For those on Facebook, please search and find our Facebook page and give us a like. We post a lot of information about healthcare and natural remedies that you can use at home. Join us next weekend for another edition of the Chiropractic Corner right here on WJUP The Jupe, 103.9 FM, Friday morning at 9 a.m. right after the Dick Farrell live show, and again Saturday right after the 10 a.m. news. Until then, be well, live well. We'll see you next week.